Lab 2 is an overview of various organ systems with an introductory level of detail. As we move through the course, we'll be revisiting each of these with a higher level of detail. And beginning with the skeletal system here, we're going to start with learning the bones, just the general bones of the skull. There's many more than what's on this list here. And we'll start with the labeled image, and then we'll skip over to a photograph of the model. So you notice this is chapter 6 of the textbook. It's helpful illustration to study. And we see the lower inferior part of the jaws, the mandible. The superior portion of the jaw is the maxilla. Getting to the cranium, the area of the forehead, the frontal bone, the most superior section, there's a pair of right and left parietal bones. All the way at the posterior portion of the cranium, and the word for that is occipital, the occipital bone. And on the lateral side of the cranium, you can see the ear canal, and there's the paired temporal bones. And switching over to the model, again, just a photograph and a color coding is helpful. So we have the mandible, the maxilla, frontal bone, parietal bone, the temporal bone, and we can just barely see some of the color coding for occipital. So we do have the textbook figure. And a view just from the anterior side, so the mandible, the maxilla, the frontal bone. So now moving on to the vertebrae of the spine, that's highlighted here. They're found from the most superior cervical vertebrae, cervical meaning the neck, and then spanning down to the chest, thoracic, the lower back, lumbar. The sacrum is a part of our pelvis, part of the hips, and then the inferior tailbone, the term is coccyx. So just working our way down from superior, and coccyx is inferior. And another great textbook figure. This is in chapter 7, you notice. So we can start here with the vertebrae, the spine. And again, just working our way down, we have the 7 cervical vertebrae in the neck, the 12 thoracic vertebrae that correspond to our 12 pairs of ribs, the 5 lumbar vertebrae. And when we reach the area of the pelvis, we can see the sacrum and little tip at the end, the coccygeal vertebrae. Or another way to see that, we'll have our poster here, cervical, thoracic vertebrae, lumbar, sacrum, and coccygeal. And just a much closer look to make it very clear. We have 7 cervical vertebrae in the area of the neck. There's the 12 thoracic vertebrae in the area of the chest, the 5 lumbar vertebrae in the lower back, and a simple way to remember that, 7, 12, 5. At 7 a.m. you could have breakfast, 12 noon lunch, 5 p.m. dinner. Kind of corresponds with those numbers. And then we have the area of the sacrum and the tailbone. Again, the name for that is the coccyx. So that's our section for vertebrae. And we can see that on our chart here. So now there's the sternum and the ribs, the breastbone and the 12 pairs of ribs. And let's just go back to the chart for that. So our sternum, right, the breastbone right down the midline. And then we have the 12 pairs of ribs. So now moving on to the appendages. We have the bones for our arms, our pelvis, our legs, fingers, and toes. So again, this figure in chapter 7 is really helpful. It's an introduction. And you can start out with the collarbone, the clavicle. The posterior shoulder blade is the scapula. And working our way down the arm, there's the funny bone. That's where the name humerus comes from. And now we notice the skeleton is not in anatomical position. The arms are slightly medially rotated there, slightly pronated. So it is the lateral bone when we describe anatomical position. The lateral bone in the antebrachium in the forearm is the radius. And the medial bone is the ulna. The ulna is also larger. And then once we reach the area of the wrist, there's multiple bones known collectively as carpals in the wrist. Metacarpals are the bones that are in the area of the palms. And then all of the bones in the fingers are collectively referred to. The plural form is phalanges, the bones that are in the fingers and the toes as well. So that was this section moving through here. And we could take a closer look at those still. So for the arm, again, so we can see the scapula, and there's the humerus. This arm is in anatomical position, so we can see on the lateral side, and we know it's lateral because the pollex, the thumb's lateral. There's the radius and the medial side of the forearm. This here is the ulna. And now the bones here at the wrist, these 8 small bones at the wrist, 8 on each side. There's the carpals, the 5 bones right here in the area of the palm, 1, 2, 3, 4, 5 metacarpals. And then all of the multiple bones in the fingers are called phalanges. And keep in mind this picture right here zoomed in, we're looking at a right arm. So now moving down to the pelvis and the lower extremities, there's a bone known as a coxal bone, or also called os coxae. Os just simply means bone. So a coxal bone, this is one large element of the pelvis. So let's just bring that up here, closer look. So this figure here is a pelvis, everything that we see. However, the coxal bone, and we'll just go ahead and label it. Here's that term, os coxae. Here is just one coxal bone that's being highlighted in red. And you can see the other side here. So one major coxal bone that is made of these distinct 3 elements we'll discuss later. We've already seen a part of the vertebrae, the sacrum, and a closer look here at the tailbone, the coccyx. So we have the paired ossa coxae and this cartilage that connects the 2 halves together. That could be called pubic symphysis or symphysis pubis, but that's referring to the cartilage. So now moving down the lower extremities, the femur is our biggest, strongest bone. It's in our thigh. So the femur. We have the kneecap, the patella. The larger medial bone in the cruce, that's called tibia. And the smaller lateral bone is fibula. At the ankle, on each side, there's the 7 bones here at the heel and ankle. They're called tarsals. And then there's 5 metatarsals. And all of the bones in our toes are called phalanges, just like the bones in our fingers. They're all collectively referred to as phalanges. For the respiratory system, it's just these 3 organs for now. Our trachea that branch to bronchi, leading to the paired lungs. And to see the respiratory anatomy, we'll quickly take a look at the chapter. 24 is a great introduction. Just 3 organs. So we see the windpipe, the trachea, the multiple branches that contain cartilage. Those are the various bronchi. And then we see the 2 organs, the paired lungs. So just the 3 respiratory organs. We can see the lungs here. And with another image, we can see the trachea. And as the trachea branches, it's now here. That's where we're able to see the branching of the bronchi. The lymphatic system, we're going to use solely just a textbook image. So that's all here on this figure. So this exact figure, 23.1. So the tonsils, there's multiple tonsils found in the area of the throat. We don't need the details yet. Scattered around the body, represented by these green dots. That's where we see various lymph nodes around the body, illustrated as green dots. Whereas the green lines would represent lymphatic vessels. So just all around the body, various lymphatic vessels as these green lines. The thymus, as a reference, is located just superior to the heart. And we see the position of that thymus gland. And we have a spleen that you notice is towards the left side of our retroperitoneal space, the left side of the abdomen. So any lymphatic information directly from this image here. The cardiovascular system, we're seeing the 4 chambers of the heart and then blood vessels. So let's go over to here. And chapter 21, this is the chapter on the heart, and here's just a good figure for introduction for now. So what we're able to see is, first of all, we're viewing a heart from the anterior side. So we're looking at, imagine, someone else's heart. So for this reason, you notice on this side of the image is where we have the right atrium. And that's the superior right chamber, is the right atrium. The inferior right chamber, that's called the right ventricle. And then it's paired to the superior left chamber. Superior side to the left is left atrium, and inferior left is the left ventricle. For now, we're going to keep it pretty simple. Arteries versus veins. And what we'll do is, just to point that out, we would just use the red color to indicate an artery, and the violet color to indicate a vein. That's not truly the only rule, but we'll use that for now. Artery. Reviewing a heart from the anterior side, and we have here the right atrium, the right ventricle, the left atrium, and the left ventricle. And again, with the blood vessels, to keep it simple for now, we'll just point to a red blood vessel for the artery and a blue one for the vein. The digestive system. So starting at the area of the mouth, and that's the term, oral cavity is the term for the mouth, and we'll just move through the tract and then finish up with a few key organs. So we could begin with the image in chapter 25 as a basic image that shows the general anatomy, and then we'll switch to a poster. So the mouth, the oral cavity, and then we want to span down to the esophagus, which leads to the stomach, distal to the stomach, to use that term. beyond the area of the stomach, further away from the origin. Distal to the stomach is first the small intestines, which has a smaller diameter, but it's a much longer tube. And then the large intestines, it's a shorter length, but a much larger diameter. And the distal end of the tract is the rectum. There's the liver, so this largest organ we have in our abdominal cavity. And just inferior to that, we can see this green pouch of the gallbladder. And posterior to the stomach is the location of the pancreas. So to see that on our charts, we could start here with the first view, and we could see a bit of the stomach. You can see the stomach here, a portion of the liver and gallbladder. Here, this darker section, we can see sections of the large intestines. And then coiled up all here, we can see small intestines. Moving to the second layer view, we can see the stomach again, the liver, the gallbladder. The small intestines, for the most part, has been removed. There's a little bit here we can see. I'll put small intestines. And then we can still see a large bit of the large intestines with the section cut out, and then more of the large intestines again. Moving now to this view, we're able to see here, you notice, the esophagus. And now at this point, the stomach, small and large intestines have been removed. And we can see this last bit here of the rectum. The urinary system, again, there's just 6 organs: paired kidneys, paired ureters, urinary bladder, urethra. So we can begin here. Chapter 26, that first image. So again, there's the paired kidneys, the paired ureters, the urinary bladder, and urethra. And moving back to the same poster, so we can't see anything from these views. We have to go into the deeper layer. And again, we can see the kidneys in a pair on both of these images. Descending down from the kidneys, there's the ureters, which would propel urine to the urinary bladder.